Let's start with an overview of fertility. Can you give us an overview of what male infertility might look like?
So when I'm thinking about it, I'm always really looking at the couple. And the way I think of it is, let's say that it takes 100 points to conceive. So some points come from the man and some points come from the woman. If they're usually in my office, then they have not easily achieved those 100 points.
Right.
And usually the criterion are that it's been a year of trying for a couple, and if the woman's over 35, then we usually use 6 months. So what I tell them is that there's really three ways of getting points. So one is to see what's going on with the man, and that's my job. So my job is to basically establish a baseline for his semen analysis, because there can be variability. Secondly, see if there's anything medical that could be affecting his health that's going on. And then of course, three, see if there's anything I can do to improve it.
Okay.
The second way is to do the exact same, but with the reproductive endocrinologist, doing that with the woman, seeing if there's anything reversible. She's not ovulating. Does she have a fibroid in the uterus? And then once we've maximized, it's best to maximize those points, because then you bring those points into every cycle that you try to conceive. And then the third way, if those aren't enough or we don't find anything, is to try to get her more fertile in any given cycle. And the principles are to try to get her to make more eggs and to get his sperm closer to the eggs. So there's
Yeah.
inseminations and there's in vitro fertilization.
Okay, so pretend that I'm a woman, right? And
I think you are a woman. I don't have
yes.
to pretend, yes.
So I know that when my husband and I were going through our infertility journey, he happens, I'm very open, but he happens to be very private. And I wasn't with him when he was having his sperm analyzed. What actually happens when you're like, obviously you're going to be using a microscope, but what happens? What does the man have to do in order for you to
Do a semen. So
do the semen?
a
Yeah.
lot of the men are very recalcitrant about doing a semen analysis. Historically, people always just blamed the woman if there was a
Okay.
problem. And they would have, when I started my practice, so that's 27 years ago, basically the woman would have her full evaluation before they dragged the man in to have a specimen. And that
Mm-hmm.
is not the case anymore. I'm finding
Okay.
that it's sort of, the OBGYNs are like, the first thing they do is like, okay, you go get a specimen. And so we have a lab and we see, more than 2,000, we do more than 2,000 semen analyses a year, some of which are screening.
Okay.
But in terms of the production, the men are getting better and better at this. And so they just know that it's their job. So they're supposed to abstain for 2, 3, or 4 days. So 2 to 4 days, meaning no
Okay.
masturbation, no intercourse, no ejaculation of any kind. Then most of the vast majority of the men will then come into our offices to produce the specimen. And they have their own room and, a lock on the door and a lubricant, and they can use their phone if they want, or a video for pornography, and they produce the specimen, obviously in private. They get dressed, they ring the buzzer, and we do the semen analysis.
Does it have any, we get these questions a lot of times from the women. Does it matter if they are requesting to do it at home? Is it a difference for you?
Yeah, so it's a good question. So we do have men who are much more comfortable at home. And so you just want to make sure that it stays at body temperature. So we don't want it in the freezer or on the radiator. Easiest thing to do is just tuck it into an internal shirt pocket and put on a jacket. And we'd like to get it within an hour. Because what happens is, ironically, the fluid that a man ejaculates a sperm into, in the semen, is actually not good for sperm. What happens when a man ejaculates is it goes into the vagina, obviously. The sperm are released into the cervix, and the fluid that they actually like is the fluid that's found in the woman's reproductive tract, specifically in the tubules, which is where fertilization, the fallopian tubes, which is where
Mm-hmm.
fertilization takes place.
All right. Well, thank